Hi, my name is Peter Bedreau, and I've worked at the Rehabilitation Institute of Oregon in Portland for the last 40 years, and I'm recently retired. And today, we have a series of videos about stroke care, and what I'm going to focus on today is using a TENS unit to help with shoulder pain. Now, this TENS treatment could be used on a variety. Let's say a person has back pain or knee pain, wrist pain, so forth. So it's not just for shoulder pain issues, but we'll demonstrate that because that's the most common pain problem for many stroke patients is shoulder pain. In terms of treatment, TENS is just one of many kinds of treatment modalities we would be considering. In fact, it's kind of a little bit down on the list, but it's a kind of technical, so this video will help you through that part of the technicality of it. Commonly after a stroke, well, this guy's missing his arm altogether, but some of the pain comes from the shoulder blade, the scapula, not moving very well, either because some muscles are tight or some muscles are loose. There's a lot of muscle imbalances. The other common problem that causes pain after a stroke is that the shoulder could be subluxed, or if the person with the stroke or a helper moves the arm too aggressively and this part of the humerus butts up against this part of the shoulder blade, often that can cause some inflammation and problems. So these are all things that I address in some of the other videos, and the occupational therapist will often be working with the patient and their families to help them take care of this arm in a 24-hour basis, positioned well, being moved well, being cared for nicely. But this video is just going to focus on the TENS unit treatment. And we're going to use the twin stem device to do this particular treatment. So I'm going to show you how to program and use the twin stem device for a TENS treatment. And I've already put on the electrodes. So this area right here tends to be the spot where a lot of people have pain. Again, right below the acromion process. But basically, when you find you have a pain anywhere, you would be basically surrounding that area. And I'm just going to use 2 pads today. I could have used 4 pads, like 2 on this channel, 2 on this channel, but just for simplicity, I'm going to use just 2 today. So let's say my pain tends to be right here, and I can't get a good night's sleep. So I might put on the TENS unit for, let's say, 30 minutes in the evening. It will help with the pain, and then I might be able to get to sleep easier. And then let's say 4 hours later the pain has returned. I usually would just leave this on. I might turn on the TENS unit again for another 30 minutes. It will stimulate the area. I might be more comfortable, hopefully, and get back to sleep. Now, a TENS unit works because it is stimulating that part of the body where the pain is, and that stimulation hopefully is getting to the brain before the pain signals are. It's just like if, let's say, someone punched me in the shoulder, I'd probably hold my hand over the painful area, and my hand is distracting the pain signals going to my brain. So we kind of automatically try to distract pain that way. And this is just an electronic way of doing that. So it's the gate theory of pain control, where you're trying to give an alternate stimulation from the pain. So to program the unit, you would turn it on with this button in the center. Now this, if you see any of the other videos that I've done, I have 3 others that will talk about using this unit to stimulate muscles for muscle recovery. The TENS isn't for muscle recovery, it's focused on pain management. But this unit can do both. If I press normally there's an M here and an S there, we've worn it off. But if I press here, I've toggled it over from EMS to TENS. So now this is ready to do a TENS treatment. Now in TENS treatment, this particular unit has 4 different options. It says B, which it's going to be kind of a, it's going to feel almost like a pulse, and you can program it how fast the pulse is going to be. So let's say it's on the shoulder, and it would feel like someone just tapping with this little electrical stimulator, just like that. So it feels kind of like that. Next to that, it has an N. I'm not sure why it says N. It should be, in my mind, a C to tell you that it's going to be a constant stimulation. So it would kind of feel like that in that painful area. The next two, M and M1, it's more of a wave kind of feeling to it. So if I was going to describe it to a new patient, I would say it's going to feel more intense and then less intense, and then more intense and less intense. And I'll say when I do this on a patient, I'll have them feel all 4 types of stimulation, and a lot of people like either the M or the M1, one of those 2 ones where it comes and goes in a wave. Again, you're trying to distract the pain with this electrical stimulation. And it's got to be high enough that you can notice it, but not so high that it's causing its own pain problem. So, and I'm not going to demonstrate all 4, but I'll show you how to get into them. It's on B right now. Let's say I prefer it to be just a constant one. So to switch over, you can see the B is flashing, and I can use any of these silver buttons to kind of move it from B to N to M to M1. And let's say, just for demonstration's sake, it's on N. So it's going to give me a constant stimulation. Next, this should come already programmed. But let's say I want my first treatment session to be just 15 minutes long. Right now the clock is flashing, and I would press either of these lower buttons to move the minutes down to 15. Let's say 15 is good, but I'd like to move it up to 30. I just bump it up or down that way. And both of these buttons do the same thing. So it's at 15. Now for this one, the pulse width is going to be a constant 200. Each pulse of electricity is going to be 200 microseconds long. And I'm going to press S, and it's going to be 50 pulses per second. Now when this is on, it shouldn't be so strong that it's moving my arm around. It should be more of a vibration. Like with the electrical stimulation, it'll actually move a joint, but that shouldn't be what happens with the TENS treatment. So anyway, 200 microseconds long, 50 pulses per second, and we're ready to go. Now what you're going to be doing is pressing, since I have it in channel 1, you're going to be pressing this button to go up, this button to go down. So I press it up, and probably I'm going to start feeling it in the high single digits. There we go. So right now I can just feel a tiny tickle where these 2 electrodes are. It's not high enough to distract the pain at this point. Okay, I'm in the mid-teens, and I can definitely feel kind of a vibration right in this area. And if I had a pain, depending on if it was just a mild pain, 15 might be enough, because I can feel this. And it basically feels like someone is doing this, but kind of electrical in nature. If I went up higher, so 20 is a definite, it's like someone's tapping firmly on this area. So if I had a painful shoulder, about 20 might be where I am. Now, let's say you are doing this and you're going to 20, 30, 40, and you're not feeling anything. Then you want to problem solve. You know, is it plugged in? Do I have it in the right location? If the electrodes get old and it's not sticking well, it also won't transmit the stimulation. Also, you wouldn't want to use any kind of lotion on this area because the electrodes won't stick well if it is competing with the lotion. You wouldn't want to put alcohol on it because that would dry the area, and you want kind of a moist skin, not wet, but somewhat, not dry skin, but just normal skin to have the stimulation going through. So this is working for me at about 20. If you had it too high, it's going to be painful and you don't want it that high. If it is too high and you're saying, ow, ow, that's really painful, you could just pull the plug and that will stop the stimulation right away. If you say, okay, that's a little too high, let's adjust it down, you would just press the down button. So it just went from 20 to 19. So let's say 18 is a more appropriate level for me with this. If, let's say it's at 18, and I've had it on for a while and they say, you know, I think it should be a little bit higher now. Let's say it was 18 and the screen was green, I would have to press down and then press up to go up. And I'll wait till the screen goes green so I can demonstrate that. It's kind of in programming mode right now. There we go. When the screen's blue, it's in programming mode. So right now it's stimulating kind of constantly. If I press up, nothing happens. And you can see there's a little key there saying I'm blocked out. This prevents you from accidentally hurting yourself by pressing the up button. Let's say you sat on it. So for me to go up, I have to press down. Now it's 17, and now I can go up. So let's say I go up to 22. And at 22, I can definitely feel this tapping on my shoulder. So that's how you adjust the stimulation to go up or down. Now, if you're resting, you probably could stand to have a lower number than if, let's say, you're wearing this during an activity like walking, then you may want to have a higher number because with walking, there's other stimulation going on between you know, all the effort that goes into walking. Now, let's say this is too high or I just want to stop. I could press that down button and then M, and that cuts it out. So the ways to stop it are either pull the plug, that's one. Two would be to press the down button and then the M button, that stops it pretty fast. Or you could press the down button and the power button, and this is the slowest way to turn it off. So that's how to use a TENS unit. Some people will use it probably 3-4 times a day, maybe during the times of day that they tend to have more pain. And it's therapeutic in that with less pain, then you're going to be able to move around more comfortably, which should help the blood flow overall. But you want to have a good full rehab program on a painful shoulder, not just relying on the TENS unit. If you're going to use a TENS unit, you should discuss it with your doctor first and get okay from them. Because especially if a person has a pacemaker, you wouldn't want a TENS unit sitting right next to that pacemaker, interrupting the efficiency of the pacemaker. So talk it over with your doctor to see if there's any contraindications. If there's not, you could use this video to help you learn how to do this or use it on a family member. But I encourage you to also work with your therapist, your occupational therapist or physical therapist on pain control overall, and especially pain control with a TENS unit. So hope that's helpful. Thank you very much.